Live from Studio 6B in Rockefeller Center, this is New York Nightly News with Chuck Scarborough.
Last week, the Obama administration unveiled a plan to end homelessness in America. It has some very ambitious goals, like putting an end to chronic homelessness in 5 years. Well, is that even possible? Here to talk about the president's plan to end homelessness is Donna Colonna. She is the CEO of Service for the Underserved. Donna, welcome.
Thank you, Chuck.
Now, homelessness has bedeviled every administration I can think of. And what makes you think that this plan can succeed where so many others have failed?
Well, it's actually the first comprehensive plan put out by the federal government. So in some way, it's a vision statement as much as it's a statement of strategy. And it takes a lot from what has been done in cities and states throughout the United States over the last 10 years. So, for example, New York has had a plan under Mayor Bloomberg, 2004, a plan to end homelessness, and has been fairly successful in terms of building supported housing for people who are chronically homeless, has a fairly new rapid rehousing program to address people who are coming into the shelter system now, and rather than staying in the system, getting them out more quickly, dealing with sort of linking them to services and job creation. So I think that it's important to have aspirational goals, and I think Sean Donovan, who's the Secretary of HUD, said that basically that in order to get things done and to drive change, sometimes you have to set up a comprehensive plan with aspirational goals. It has strategies. It really does borrow from some models that have been very successful, and I think that it has a lot of hope, and it puts a lot of statistics in place that put front and center the kinds of numbers that we are experiencing in America, and I think that it talks a lot about how homelessness is unacceptable.
Well, that's what I was reading on the government's website, the White House website, the administration's, and yes, there's a lot of aspirational stuff going on here, and there's this notion of getting everybody to work together happily. This is something that happens a great deal, where people get together, spend a lot of time, come up with some sort of grand dream for the future, but nothing then gets done. It doesn't work if you don't put the dollars and cents and the plan in place. What's going to make this one work?
Well, there's very limited new money, although there is an increase in some of the federal money through the stimulus money. About $1.5 billion was introduced through that money for rapid rehousing and dealing with some family situations. So you're right. I mean, in New York City, we're pressed right now. There's an economic situation. The city passed a budget which does some limited cuts to AIDS housing and supported housing, for example, and some housing and supports. So at the same time, while I think New York City and other cities throughout the nation have done some very significant things, I mean, there's been a reduction in homelessness. There's been more people entering the system, but less people staying into the system. So I think that the collaboration piece, we've seen it in New York City, where the city housing department, for example, has collaborated with the Department of Mental Health, with the Office of Mental Health, with the Department of Homeless Services. And so those models are working. It's true, you have to fund them. And but it's possible, I think, that the cost of not doing it is far greater than the cost of doing it. And I think that's a public education piece.
All right, Donna, thank you very much for coming in.
Thank you.
Appreciate it.